It's that kind of like classic practice element mixed with kind of a cord cutting streaming service, all mashed into one, where it's really healthcare on demand.
Well, hey, Chris, welcome to the show. How are you?
Hi, Rafi. Thanks for having me. I'm doing very well.
Awesome. I'm excited to talk with you about Freedom HealthWorks, about direct primary care. But before we do any of that, just give us a quick rundown who you are and then what brought you to doing what you're doing now.
My name is Christopher Habig. I like to think of myself as just being very curious about the way the world works, and that has led me to kind of self-label as a problem solver. So right now, professionally, I am the CEO and co-founder of Freedom HealthWorks. We are a direct care community across the United States, empowering physicians to tear down the roadblocks and barriers for patient access, advocacy, and affordability by using membership medicine, or what's known as the direct primary care model. So it's been a long road getting here, but we like to be opportunistic, and we really like to help people. And we see problems in healthcare, and we're like, you know what? This is something that we should return control back to patients and physicians. And so that's what we're doing.
Yeah. And for those who might not have heard, what is direct primary care?
That is kind of hopping back your time machine, going back to like the 1960s and like the old school Norman Rockwell, like a doctor making a house call, taking care of everybody. It's that kind of like classic practice element mixed with kind of a cord cutting streaming service, all mashed into one, where it's really healthcare on demand. The hallmarks of it are increased accessibility. You're doing same day, next day visits. The doctor actually knows you. You have the ability to text your doctor, symptoms, that kind of stuff. And a lot of it is just peace of mind. So, functionally, what a direct primary care practice does is they charge you a membership for belonging to the practice. These doctors will downscale their patient panel from about 2,500 in insurance-based practice to maximum about 500. And that is really kind of the upper limit of how many human beings we can actually understand and know the names of and get to know on a really kind of surface level. So max number 500 patients. Nationally, it's about $85 a month for all you can eat primary care, or all you can access primary care, probably be a better analogy for it. And what it does is allow the physician to really enjoy practicing medicine again, gives them quality of life back, and it really helps out. Like I said, it's a new experience for patients to really enjoy going to the doctor, and with more of an emphasis and incentive on maintaining their health. I like to tell people that this is the only healthcare model out there that is built for all plans. We take uninsured, we take underinsured, we take commercial paid, we take Medicare, we take Medicaid. All of it works because those barriers to joining a doctor and accessing a doctor are gone.
Yeah.
They're absolutely gone. So you're not penalized for the copay anymore. You're not penalized with a 3-week wait. You don't really care how co-insurance works. You don't really care if you say the wrong thing about your knee hurting and now your preventive visit is no longer a preventive visit and you get a surprise bill later on. So there's just so much garbage in healthcare that makes it a miserable patient experience, where most people throw up their hands and be like, you know what, I'm never even going to call the doctor again and roll the dice. We're trying to change that, and we are changing that on a very fundamental basis for doctors and patients. So kind of a long-winded explanation there, Rafi, but hopefully the hallmarks of that came across, that just like somebody doesn't need 500 cable channels and paying too much for it, I can go and join Netflix and watch a movie that I want to watch whenever I want to watch it, wherever I want to watch it. The same principle applies to healthcare services.
Yeah, exactly. Well, and I think the thing that is so cool about it is that by nature of these physicians being the way they are, right? They're not accepting insurance. A lot of times many of them have opted out of like Medicare or something like that as well, that the barrier of a pre-authorization or a denied visit or whatever it happens to be goes away, because the relationship now is no longer being mediated. And this is the problem in healthcare, right? Like in a normal economic exchange, you give me a cup of coffee and I give you a couple bucks and we shake hands and walk away. In healthcare, I want the cup of coffee for you, but I got to ask my buddy Sam, who doesn't really know me at all, and just, maybe I'm a list of his customers. He's got to broker the deal, and sometimes he's going to pay for all of the cup of coffee, and sometimes he's only going to pay for half, and I don't know until after you give me the cup of coffee, right? Like, there's just a whole lot of people get their fingers in that relationship. So going direct to primary care like this really just prioritize, like you said, the relationship. So how does this work?
And I love
what?
And I love. I'm sorry, man. I just got to hop in because I'm a huge coffee geek in there, and I love your coffee analogy. But to throw even nuance in there, like maybe your buddy Sam is only going to pay for the dark roast, not the medium roast, and don't even think about trying to get the creamer over there because that's going to be a $2,000 creamer.
Yeah.
And sorry, you want a pump of vanilla? Ooh, I don't know. I'll check. I'll send you the bill. I'm going to give it to you, but I'm going to send you the bill in 6 months, and I can't tell you how much it costs. So it's less like go all in on that example, and I love it. I love it.
So from a standpoint of, okay, the patients, you did a good job explaining what the patients are getting out of this, right? They're getting access to their physician. They're getting more one-on-one. Do you have any clinicians that you speak with, like doctors and nurse practitioners that are wanting to get into this model that are worried about the idea of maybe moral hazard? Like, what happens if we give somebody an all access pass? Like, are they going to be texting me at all hours of the night? What level of demand is going to be placed on my services? Because maybe now I'm only seeing 500 patients, or my caseload is only 500, but now they text me twice as much or whatever.
It's a very popular question, and I love explaining it because from a patient standpoint, when they join a new practice, they are so conditioned to never actually being able to talk to somebody, not getting called back, not getting questions answered, that they will continue to call and call and call and call. And I'll be damned if it's 3 a.m. I'm going to call and call and call and call and call and call. When you actually join one of these practices and you call that first time and your doctor answers the phone, like people are blown away. I've seen it on people's faces before. And I've talked to doctors who are just like, my patient was almost apologetic. They're like, oh my God, I didn't actually think I'd get through, so I was just going to keep trying. I am so sorry to bother you. And the doctor's like, no, I'm glad you called me. I want to be your first resort. I'm your first line of defense against anything. What's going on? And when you talk about it that way, and it's just like once patients understand that you are there for them, that your brand promises and your core values, like they're listed on your website and your practice, are actually true.
Yeah.
It's like this wave of relief come around and be like, oh, wow, you are going to actually be there when I need you. Maybe this time wasn't as important. And your doctor will walk you through that. And a lot of, the after hours and the weekend care is just a lack of education, which means a lack of time spent with a physician and a patient. Because what I think is, an issue that needs, oh my gosh, I need to go to the ER. I'm going to call my doctor real quick. Doctor might say, hey, look, this is what's actually going on. This is not a problem. This is normal. I always tell people that, when they have their first kid, I don't understand how people have that first child and don't either lose their hair or all go completely gray without having a doctor on speed dial just to tell you this is normal when it comes to children and infants and stuff. So that's half the battle. It's peace of mind. And, that goes with trust. That goes with the relationship. So from a physician standpoint, quality of life skyrockets, absolutely skyrockets, because you're not taking 30 charts home. You're not answering calls at 2 a.m. I mean, you can if you want to, but you don't have to anymore. And very few patients, or hardly any, will ever call you when you're on vacation and you treat people like adults and say, hey, Rafi, rest of my patients, I'm going to go to Florida for 5 days, maybe a week, whatever it is, 2 weeks. If it's an emergency, call 911. If it's not an emergency, you kind of know what's going on. Get your refills by this date. Otherwise, I'm going to be accessible, but I'm going to be checking messages like, I don't know, twice while I'm down there. And guess what? People respect the hell out of that.
Yeah.
It's like a psychological switch. Like once you know it's there, it's not an emergency. I don't need it anymore. And I can't tell you how many doctors have yelled at patients, be like, don't apologize. Don't think you're wasting my time. I want you to call me. I want you to use me just in case, there's something there that we do need to escalate this. But yeah, I'm glad you texted me. I'm glad you kept me up to date about it. And that's how, my family uses our DPC physician a lot, is just saying, hey, just make sure your doctor's aware of it. because half the time she probably doesn't need to know about it, but she's thankful because if something does happen down the line, we can understand the entire environment and make sure that there are no complications to medication or OTC that we might have adverse reactions to, or diet plans, that type of stuff. We're able to keep our primary care doctor abreast of all that. She loves it, but nobody else really has that experience with an insurance-based practice. Yeah, nobody.
Well, and how much of that too, like it's on the patient side and the doctor side, where there's just we come into this relationship, this DPC model, with all this baggage from healthcare gone by, right? Like these doctors they're coming from an organization probably, unless they went right out of school into direct primary care, where they were seeing 80, 90 patients a day. They were taking all these charts home. So there's like a built-up anxiety, but at the same time, they don't know any other model, right? So how much of like your work with physicians are you trying to like coach them through, like, no, there will be people that will still see you, like you're not tied to the insurance model? Because I think there's some level of the insurance is what pays my bill. Why would I ever walk away from it? Like I hate what I'm doing. It stinks. I'm getting burnt out, but I can't see another way out.
There's a mindset that's prevalent amongst the medical community and the physicians that independent practice is dead.
Yeah.
And that's what is being taught right now in medical schools. With medical schools, there's this emphasis that if you go to some of the more elite medical schools, like we don't produce primary care doctors. We only produce surgeons and this kind of stuff. So there's like this big stigma, and there's a point for me going into this that, the teaching hospitals and the teaching schools are at the crux of this. To kind of flip that around a little bit, when I talk to a doctor and they're like, I'm like, did you have any business experience before? And they're like, well, we had one business class in medical school, and it was all just looking out how to code.
Yeah.
And I'm like, wait a minute, did they not teach you at least like how to balance a checkbook? Well, no, we had some of that in high school, but nothing here. I'm like, wow, you're setting people up for failure. And so, when you walk through that entire journey and they think that, wow, insurance-based is the only way to go, and that's how they're doing it, right? They're trying to figure out how to code certain procedures this versus this for maximum reimbursement. There's such a conflict of interest that exists, and I don't think enough doctors really see that. I mean, how many hospitals are really strong-arming their doctors to say, hey, primary care, you're just a really expensive triage, and most hospitals lose $150,000 to $200,000 a year on a primary care doctor, because they know that one primary care doctor is going to lead to $5 million in referrals for specialists and surgeries. I mean, there's something so fundamentally broken that when you finally do open their eyes about this, they're like, "Hey, you're kind of an accessory to this." They're like, "Holy cow! I don't want anything to do with that anymore. I want to go do my own thing over here. I want Freedom Healthworks to help me start a DPC up there. But what do I do? Because so many of them have this addiction to salary.
Yeah.
And it's comfortable. Then they get loaded up with debt, and they get, all these things, all these factors come into play. And so, it's the really smart ones and savvy ones. I guess smart's the wrong word. They're all going to be very intelligent people. The savvy ones that say, you know what, I don't want to just be in this hamster wheel, get loaded up with boats and cars and houses, and be living paycheck to paycheck. I think that's the biggest thing that shocked me from this industry, Rafi, is how many physicians, the best and brightest of our community, the most empathetic, the people actually going out there and devoting their life to caring for other people, are living paycheck to paycheck, when we think of physicians as, kind of like the 1%ers of the world that have so much cash. And so all that comes down to the business savvy of it, that, they look at insurance and Medicare as this safety net, when in reality, all it is doing is impairing patient care. And once they're out of that, not a single one wants to ever go back.
Yeah. I've got a couple of friends that own a direct primary care practice, and I was talking to them a little bit ago, and like, oh, I would never go back. There's not a chance in hell that I would ever go back to doing insurance space. And their main reason was the time thing was huge, but Davis was telling me, like, when was the last time you had a 45-minute appointment with your direct primary care physician? Like, never in the U.S., right? But all of his patients, when they come in for their first, like when they're establishing, it's a 45-minute to an hour appointment so that he can sit down and figure out what's going on with them and take into account all of their past medical history. It's not like he's stuck reading a chart and he's got 15 minutes and then he's got to get out of there. And I think that is so big for clinicians that are used to probably running at the point of burnout, to being like, oh, I get some breathing room and I get to actually care about my patient, right?
Absolutely. And you look at like suicide rates, you talk about burnout. I think that's more the moral injury than anything, is that we are redlining our doctors, the people that are responsible for taking care of us, all of us. We're redlining them. And so what does that do to their judgment? What does that do to their motivation to actually take the best care and get to know me as a person, and understanding that my DNA is completely unique. There's not another me out there. This isn't an assembly line. We're not going to be making Toyotas and Lexuses like some hospitals try to make it out to be, right? Everybody is completely unique. So a medication that works for you is not going to work for me in the exact same ways. There's a lot of similarities, a lot of patterns, but that's why it's the practice of medicine. It's always evolving. It's an art mixed with science. It's kind of like the intersection of those two. And that's why it takes unique people. That's why not everybody can do it. And that's why they're so well compensated usually, because not everybody in the world can do this type of thing and have that type of mindset. So yeah, I totally understand what you get from it. And time again, when I ask doctors, I go, I love talking about like quality of care. It's like my big thing, because I have conversations with chief medical officers, and I go, hey, what do you actually do as a chief medical officer at your hospital? And they'll give me a great answer. They'll be like, oh, I'm a liaison between our physician forces and workforce and our administration to make sure that the doctors are happy, but we're also meeting all of our quality of care metrics and all this kind of stuff, and pushing our vision of the hospital forward. I'm like, oh, great. I go, curious, what does quality of care mean to your administration? And the honest ones will laugh and say, well, it's whatever Medicare and the insurance companies tells us it is. Yeah. And the first time I heard that, my jaw hit the floor. I'm like, are you kidding me?
Yeah.
I go, what do your doctors think about that? And they said, well, none of my doctors have actually asked how we define quality. I'm like, oh my gosh.
Yeah. Well, and it goes back to that idea of like, we've got bureaucrats running healthcare a lot of times, right? These people that they're not clinicians. They're either appointed or they're MBAs. They're making decisions based off spreadsheets, right?
Totally, but Rafi, I feel strongly that there's a willful ignorance in the medical community, that they've gotten comfortable just being employed in hospitals. And I just want to be an employee now, and this will just help me see patients, and they just kind of put the ostrich burying their head in the sand. And a lot of times I'll tell doctors, I'm like, if a patient walks into your office and you recommend a flurry of tests and imaging and referrals, and you don't know the price of that or what that's going to do to them financially, you're part of the problem. Because so many doctors are just like neglectful from a pricing standpoint. They say, well, I'm just going to make sure I take the best care out of this person, not even thinking about if that puts them into bankruptcy or not, which is happening across the United States. It's the number one driver of bankruptcy is healthcare costs.
Oh, wow. That's interesting. Well, part of that is because nobody knows, right? Nobody knows the cost.
The highest growth of bankruptcy are fully insured patients with medical bills.
Yeah, that's crazy to me. So I guess what do you say to a physician? Because I'm sure they're all coming to you saying, I want more freedom. I want to be able to do this. I want to set the practice. How do I do it? I've worked for a hospital-based family care practice for 10 years, and I don't know the first thing about setting up a primary care practice. What do you have, like a list that you give them, like, here, focus on X, Y, Z, and do this, that, and the other to get at least foundationally on the right foot?
There are lists out there. There's some great checklists if people want to go out there that do it themselves. We call it the DIY crowd, and I'm their biggest cheerleader. Like, if you can do it on your own, great. If you need help, then call us. Yeah. That's what we do. So, from Freedom HealthWorks, we'll put our incubator hat on, and so we'll help you go through those steps of starting a business. Our process about 90 days from start to finish.
Oh, all right.
We will teach you how to be a business person. We will actually, our team is in place pushing buttons and pulling levers for you. So when you join our program, you actually have a team that's executing things for you. So we're going to get all your paperwork together and say, here, this is what you need your signature. Great. We're going to send this over to our vendor relationships. They have like your Freedom Health Works, like office supplies box that shows up at your office. Same thing with, vendors. We're like, okay, we have all the major vendors. Like, here's our prices. Here's our cash prices over here. You get to buy into our book of business, which saves you hours and headaches and all that kind of thing. We do all the branding, all their websites, their logos, everything like that, how to talk about it. We do a lot of sales training. And so finally, when the practice is able to start, we're kind of in the background. We're operating in the background more of a white label service than anything. Yeah. We'll take our incubator hat on, all right? And then we'll put, it's really more of our kind of a growth hat on. Like we'll put our management hat on and say, awesome. We have services to enable your back office and your front office so that you don't actually need to go out and hire 4, 5, 6 different people. Rely on us to do that. Technology has come such a long way where we can pretty much do everything except for draw blood for a patient. Yeah. I mean, there's some things you're going to have a need on or a hands-on approach to. And then, once we're beyond that, we connect you with other physicians in our community across the nation so that you're not alone. I think that's one of the biggest drawbacks of returning back to independent medicine is that it can get a little lonely because if you're in there, you're in practice all day talking with patients and maybe you have one employee, that's about all you need with a full practice. Sometimes you get a little lonely and you need that camaraderie. You need that physician lounge again. So we try to connect people in different ways if you don't quite have that social network that, because you've been working 14 hours a day at a hospital. So, it's an incubator, but a lot of that is training and a lot of that is just showing them that they can do it, like instilling confidence that you are making the right decision, for your patients, but also for you and for your family. And Rafi, I can't tell you how many times that I kind of walk through our process and what we do and what we believe with a doctor on a video call. And I can physically see them, their posture improving, their storm clouds have parted. I'm like, Doc, you get to build your dream practice. As a primary care doctor, you're not just a white lab coat and a stethoscope. You're not a commodity. You're not a list on some insurance company's website for people to click through and see when they can get in. We're putting your pictures up there. We're putting your family up there. We're putting, what you want to specialize in. We're injecting your personality into the practice again. Primary care is absolutely a specialty field. Oh, yeah. And it drives me nuts when someone's like, oh, we have primary care, then we have specialists over here. No. Those are non-primary specialists over here, but primary care is absolutely a specialty. And all too often we've discounted these doctors and even nurse practitioners. We've discounted them that, you're very expensive data clerks. You're just triage so that we can go make money off of the cardios and all of the endocrinologists, those people. That's cute, primary care doctor. Let's just send them up the specialist, the non-primary specialist pipeline. And, thanks a lot. Here's a pat on the back. Yeah. And go make sure you hit all your quality metrics, and bunny ears there, and we'll see if you have a job next year. But appreciate your service.
Yeah, no, I do think these are the people. They're the gateway a lot of times into other things, but the reality is they should be the first line of managing your health, of helping you manage your health, and we don't view them that way.
They can do so much. Oh, they can do so much. A generalist is. You have range, right? There's so many things that you can handle at primary care level from, heart issues. Mental health is a huge underserved function of primary care. Everybody's like, oh, I need a psychiatrist or a psychologist. You're like, no, you don't. Maybe you just need somebody to talk to that can deal with anxiety or depression that affects a vast majority of Americans before escalating into something more serious. Primary care can handle so many different things if given the time. Yeah.
Well, and there's a lot of metrics out there and research that supports using direct primary care, right? It decreases the amount of non-necessary lab tests or medical tests or even ER visits, right?
Absolutely. Anywhere up to 80% less surgeries for DPC patients. And part of that, again, is how hospitals make money. I've talked to a handful of surgeons who are like, Chris, I was under the gun that 1 in 3 people who came to my office for a surgery consultation
were getting surgery.
I was supposed to send them to surgery whether they needed it or not. And I'm like, are you kidding me? No. Whether they needed DME, durable medical equipment, or just therapy would have been fine. I mean, you talk to a physical therapist and they're like, no insurance plan out there gives people enough sessions beyond what they, for what they actually need. Like I'll recommend 15 sessions, insurance pays for 7. Guess who I see next year?
Yeah.
That person's coming back. So there's like so many,
Exactly.
just so much just waste. And I don't necessarily want to have my tinfoil hat on, but yeah, there's a lot of a lot of things in medicine where patients lose because it is so opaque.
Yeah.
And it's hard to have an educated consumer coming into it, because if you Google symptoms, it's usually it's something horrible is happening to you, and there's a myriad of different things, right? So kind of back what I said, it's like an art and science that all these things add up, and you don't have to be Dr. House to put the pieces together there by any means. But yeah, it's all these studies you talked about are proven that time with a doctor saves specialists because primary care can handle a lot of those things. It saves on surgeries because you can find alternative treatments. It actually just saves flat out on dollars because you're actually able to shop now. There's cash surgery centers that are lowering the cost and doing surgery for like 10% of what a local hospital would do. So I like to think the DPC creates educated healthcare consumers, and those dollars, seriously add up. And I always like it when like a data person says, well, what are all the savings here besides these studies? And I said, well, I got a call from a doctor that saved 2 Medicare patients from having surgery and pulled one person out of the ER because they needed to be there. They were going to charge that to Medicare. How do I quantify that?
Exactly.
Oh, that's a good point. So, there's so many things and costs that are being missed, which is a good thing. That, time and time again, people are like, well, show me the data that DPC exists. And it exists. It's slow coming. We could do more. I will be the first person to say that, because it would certainly help my business. But there's certain aspects of the human experience that you just cannot quantify with dollars and cents.
Yeah, no, for sure. It's kind of like looking at economic policy in general, being like, well, you can't quantify the jobs that weren't created, right, because of a bad regulation or something. The same thing with healthcare. I mean, you can see what happened last year and compare that to this year, and maybe it went down a little bit because of direct primary care, but there's no way to be like, no, we saved like this many people from having this specific surgery done or whatever, right? Like it makes it hard.
I'm pretty sure I think the federal government tried to do that in about 2008, 2009, and everybody kind of laughed them out of the ballpark here. So I totally agree with you. Only the feds would be bold enough to actually try something like that. But yeah, they're real life. And so, a lot of the stories are just anecdotal, and I'm like, look, that's what we have, but it's spreading, it's working. I'll tell you that.
Yeah. Awesome. Cool deal. Well, we're getting near the bottom here. I always ask people if there's 1 or 2 main points you'd want a listener to walk away with, specifically about direct primary care, either being a patient or being a doctor that's looking at jumping into it. What would those 2 points be?
From a patient standpoint, if any patient is out there saying, how do I make an impact? I'm just one person. Next time you have an appointment or anything like that with any healthcare professional, ask the price. That's the biggest thing that you can do. You're probably gonna have a lot of puzzled looks and they're saying, well, I'm not sure. I'm not really sure how to do that. But imagine if everybody walked into an office one day and asked the price for everything that was recommended to them, that doctor would sure as hell figure it out.
Yeah, quickly.
Sooner rather than later, because I'm tired of looking like an idiot when somebody asks me the price of it. So if an individual wants to impact medicine and healthcare for the better, ask the price. For physicians out there, if you're struggling and you're like, I'm just not excited to wake up tomorrow and go to the hospital, and there are people who love it, right? I talk to a lot of very happy emergency room doctors because they live for that adrenaline rush and work stays there. If you're a physician who wants to build better relationships, take better care, spend more quality time, there is an option for you. It isn't just revolving around hospitals and employed medicine. Independent medicine is alive, it is thriving, it is possible, and you have some great people like Freedom HealthWorks out here helping you along the way.
Awesome. Cool deal. Well, Chris, where can people find out more about you, about your podcast, and FreedomWorks?
I appreciate you mentioning our podcast, because that's really how we spread those stories anecdotally. So podcast is called Healthcare Americana. It's on all podcast platforms. Company, freedomhealthworks.com. Google us. I think that's probably the best way to do it. So pretty sure we'll pop up if you Google any version of Freedom HealthWorks out there. And if we can help somebody, then you know what? That makes my day even better.
Awesome. Cool deal. Well, Chris, thanks so much.
Thank you, Rafi. It's been a pleasure.